So this is about pathology of exocrine pancreas. Inshallah, endocrine pancreas, about mainly about diabetic mellitus. We will be discussing more in the endocrine module. So we will be restricting ourselves with the digestive part of the pancreas, that is exocrine pancreas. So inshallah, after this lecture you guys can able to list the causes and types of pancreatitis, very important emergency condition. Causes and types of pancreatitis and able to explain the pathogenesis of acute and chronic pancreatitis, and you can able to compare and analyze the clinicopathological and morphological features of acute pancreatitis, and you can able to differentiate the benign and malignant neoplasms of pancreas. So before going to that, you all know about exocrine pancreas, right? The pancreas secretes lot of enzymes. As of we know, there are 22 different types of enzymes such as protease, amylase, elastase, lipase. They are stored in the zymogen granules. Zymogen granules. Okay. So in these enzymes, the most important enzyme is amylase and lipase. Why it is important? All the enzymes are important. These two enzymes we do lab test. Okay, so amylase and lipase are very important. Okay, so all these enzymes reaches the second part of duodenum and they involve in the process of digestion. Remember, cholecystitis have impact on the pancreas. Will have impact on the pancreas. They can induce pancreatitis. They can induce pancreatitis. Even the gallstone formation can induce pancreatitis. Can induce pancreatitis. And so most commonly the disease of exocrine pancreas, or most common diseases are acute and chronic pancreatitis and the tumors. And the tumors. So now let us discuss about acute pancreatitis. It will be sudden onset and they will produce acute abdominal pain. This is due to increased release of pancreatic enzymes into the circulation. Increased release of pancreatic enzymes into the circulation due to inflammation of the pancreas. Due to inflammation of the pancreas. Okay, so these are the major cause for alcoholism is a major cause for the acute pancreatitis in the western population. In the western population, it is very common scenario in the alcoholic patient. And what are the alteration happens in acute pancreatitis is there will be microvascular leakage. Microvascular, the blood vessel, the capillaries goes for damage and it will produce edema in the pancreas. It will produce edema in the pancreas, and fat will go for necrosis because of lipase enzyme, because of leakage of lipase enzyme, and there will be acute inflammatory reaction, and there will be destruction of pancreatic parenchyma. Pancreatic exocrine cells will die, and there will be destruction of blood vessel that leads to interstitial bleeding, interstitial hemorrhage. This all happens because of enzymes. This all happens because of the enzymes. The pancreatic enzymes are so powerful, so they will destroy their own tissue. They will destroy their own tissue. So it is like auto digestion of pancreas. It is like a auto digestion of pancreas due to inappropriately activated pancreatic enzyme. Inappropriately activated pancreatic enzyme. So the most important thing is trypsin is the one which gets activated, then it activates all the enzymes. It gets activated and activates all the enzymes. So in other words, trypsin goes for abnormal activation, goes for abnormal activation. That's what I told. Gallstones also can cause acute pancreatitis. Gallstones also leads to acute pancreatitis in the Muslims population. This is most common, especially in the females. So gallstones causing acute pancreatitis is the most commonest scenario. So now what happens is, in cholelithiasis or in alcoholic or any metabolic injury, anything, it leads to the activation of enzymes. This leads to the activation of enzymes. The center element is there should be activation of enzymes. What enzymes? Pancreatic enzymes should be activated. So all this will lead to activation. Any, whether it is a cholelithiasis, gallstones, or the person's taking too much of alcohol or any drug or metabolic injury, okay, will leads to the activation of these enzymes. then automatically the interstitial inflammation edema forms, proteolysis, fat necrosis and hemorrhage. These are the four things happens and leads to acute pancreatitis. Okay, first thing is see, if you remember the POD, you can easily remember the pathogenesis. In any inflammation, first thing is vasodilation. Here there is vasodilation along with injury. So that's why the leakage of fluid will be more. The edema will be more, and the blood vessels is also digested, so it will go for bleeding. Hemorrhage. And the fat goes for necrosis because of lipase. And protease will digest the proteins. So this all leads to severe acute pancreatitis. So the pathological feature will be sudden onset of acute abdominal pain, and common cause, I am putting gallstone as a first. If I am taking to the Western country students, I will put alcohol as the first, but in Muslims it is more common is gallstones and alcohol, and followed by the ischemia. Remember, the most important thing is, this is the thing which gets activation of trypsinogen into trypsin by cathepsin. Okay, by cathepsin. So that is the triggering point. If that is triggered, you cannot give any drug to stop. Okay, there is no drug available to stop this process. So it will end up with destroying the pancreas. So it is a medical emergency, because the patient will collapse because of the vascular damage, and serum amylase and lipase will be elevated. And they will end up with multi-organ failure. Very difficult to save this patient. Now coming to the chronic pancreatitis, there will be long-standing inflammation, but the inflammation is not severe like acute pancreatitis. There will be mild inflammation. Slowly they will trigger the fibroblast to produce more collagen, and they form the fibrosis, and the exocrine pancreas will be completely fibrosed. Then they will fibrose the endocrine pancreas. Okay, the beta cells, alpha cells, all will be fibrosed. So the patient will go for diabetic. So because all the beta cells are fibrosed, they cannot secrete insulin. They will end up with diabetic mellitus. Persistent inflammation leads to fibrosis, and sclerosis means very strong collagens of the pancreas happens. The most common is these are the things. Chronic alcoholism. Most of the alcoholic patient will not take proper diet. They will always have protein malnutrition. Okay, and chronic obstruction. That's what I am telling. Gallstone, if it is present there, we have to remove it, because it will affect the pancreas. And remember, the patient get usually pain after fatty meal. Because more lipase will come out. The patient slowly will develop diabetic mellitus. Now coming to the pancreatic neoplasms, adenoma and carcinoma can happen in the pancreas. And adenoma are serous tumor. They are generally benign. And they are serous. For example, in the adenoma, there will be small cyst inside the adenoma. The cyst will contain serous fluid. Okay, it will contain serous fluid. It is called serous cyst adenoma. See, this is the cut section of the tumor. What you are seeing, small spaces, right? That small spaces will have some transparent fluid, serous fluid. But here, it's again another cut section of another tumor. You are seeing gels inside. Gel-like fluid. That is mucin. So there are two types of adenoma: serous and mucinous cyst adenoma. Normally, all the serous cyst adenoma will not become malignant, but mucinous cyst adenoma is dangerous. One. So mucinous tumor may be benign or malignant. And normally benign tumors are seen in the body and tail of pancreas. They have head, body, tail. So body and tail of pancreas, benign tumors comes. Okay, they are painless, slow growing tumors, and sometimes you can see papillary growth, some finger-like projection into the tumors. That is called papillary mucinous neoplasm, intraductal papillary mucinous neoplasm. Once again, I am summarize this. See, benign tumors are called adenomas. Benign tumor, here there are two types: serous cystadenoma, mucinous cystadenoma. Serous cystadenoma is always benign, but mucinous tumor can be benign and malignant. Can be benign and malignant. If the tumor is having some finger-like growth, that is called papillary adenomas, papillary neoplasms. Now, in pancreatic carcinoma, single most risk factor we can say smoking. Understand? So it is all the cigarette smoke, all the pancreatic carcinoma patient have relationship with cigarette smoking. Okay, so that's why they are 100% sure that cigarette smoking leads to pancreatic adenocarcinoma, one of the most dangerous tumor. Why? Because not because of the tumor the patient die, the tumor secretes some substances that makes the blood to go for clotting, and that will lead to thromboembolic disorders. So pancreatic adenocarcinoma develops from pancreatic intraepithelial neoplasia. It is a precancerous condition. So it develops from the pancreatic intraepithelial neoplasia, usually commonly seen in the head of pancreas. And they produce obstructive jaundice. And they release lot of clotting factors, and they make thrombophlebitis, inflammation of the veins, and it will be also seen in the many areas. So it is called migratory thrombophlebitis, and this is called Trousseau syndrome. Most of the time the patient die of thrombotic disorder, because they create lot of clotting factors, abnormal clotting factors. The blood will go for thrombosis. So this is the dangerous part of pancreatic adenocarcinoma. So these are the difference between pancreatic adenoma and the pancreatic adenocarcinoma. Again, you can refer to the 645 and 654, the page number, and you can get more details of the diseases.